Hi, Todd. How are you? You doing okay? Todd's an amazing man. He has got several kids and has a very supportive role that he plays in that. I know your wife's quite anxious downstairs. Yeah, maybe we could give her a call and give her an update. He was perfectly well and found out this week that he's got a very aggressive and malignant brain tumor. So their world changed in hours.
Oh, I feel great.
I'm almost applied on by the right and the left nerve. Then you would come back in through the nose and then go deal. I have been with Aurora now for about 2 years. Prior to that, I was at the University of Pittsburgh Medical Center, where I was the chair of neurosurgery. And then subsequent to that, I was at the University of Ottawa. We're actually going to go to clinic now and see some patients. Aurora represented a model that I believed in, which is a patient-centric, patient-focused model. Innovative.
That's a good idea. If it's multi-stage, then I would do that.
And the goal really was to deliver the best of care possible today while we were working on building the next best care for tomorrow. We're going to go into patient care conference where we'll have cases from across the world sent in.
Then in 2010, he had a major surgery. They took out...
Annie is the Aurora Neurosciences Innovation Institute.
Almost a carbon copy of the last case.
We really create innovations in two primary venues. The first facility is a gross anatomic facility. So this first venue is our anatomy lab, where we essentially build procedures that are minimally invasive and relatively novel. This is a synthetic phantom of an actual human brain. It feels and behaves just like the brain. It means that you actually de-risk the procedure before human life is at risk. We then can experiment with cells outside of patients, where we build individual patient tumors to be able to understand how a virus might impact a cell. I'm going to scrub into 4 if Rich is looking for me. So Todd and his wife are wonderful people who are dealing with a very complex problem right now. He was perfectly well and found out this week that he's got a very aggressive and malignant brain tumor. These blue fibers are responsible for movement. The green fibers that you see are for thought and memory.
So we used to just think that the gray matter, the cortex of the brain was important, but now we realize that all these connections in between the cortex and different areas of the brain are equally important in preserving function. We can basically simulate the procedure and how much of the tumor the surgeon can access through this tube.
The coordinates of that flight plan then get wirelessly transferred directly from this system to a robotic optical system in the room. And we're going to thread a needle. Okay, great. Reset center line. So this is an optical robotic system. What the optical robotic system will do is move in space based on where the GPS unit says where the tumor is. So you can actually see the fiber quite well. And that lets us remove tumor up to that point. See all that yellow stuff? That's what we want to get out. So Todd, I'm going to need you for a little bit to talk at me while we're working, okay? We're going to be in some pretty high rent real estate for a little bit, okay? What do you do, Todd?
I work in quality for a food container manufacturer. Worked there for 9 years.
Having a patient awake gives us a remarkable opportunity to monitor their neurologic function.
He said if he hit something that he didn't mean to, I'd be the first one to know. And could tell it. It actually kept me calmer. Kind of feel like you're involved a little bit.
We are now able to approach more and more challenging, more deeply seated tumors that just a few years ago would not have been able to be approached this way.
You doing okay? You can't call me sir anymore. You gotta call me a min or I'm gonna leave.
Patients are remarkably comfortable. We can joke around a little back and forth.
So the approach we're taking with this patient is, Todd, is it okay if I call you Todd?
I can call you sir.
I'm out of here, Todd. You're doing great. We're really getting a lot out now. And we're done, okay? Offset 10. Todd, thank you. You did a great job. Thanks for hanging in there, okay? I'm gonna go talk to your wife. Went great. I had a very personal event with a family member that really impacted not just me, but an entire family. And that really drove me to trying to understand how to make a difference. So we're gonna go down to the ICU right now to find out what's going on.
The patient's here, she's getting an art line right now.
The hardest thing for me is to adjust pace, because every minute that you lose, there's somebody's life at risk that didn't get the therapy, that didn't get the treatment, that's not gonna see Christmas. The rest of the family. So for me, there is no such thing as pace. So the next part of the process is to enjoy him today. I think he should get out of here tomorrow and be with the kids, and he should enjoy that. I'm real happy that the day went as well as it did. All right.
Thank you.
One step at a time. Family, kids, wife. The only chance he has is if we can figure out a way of making that virus kill his tumor. So what am I gonna do tonight when I go home? That's what I'm gonna think about, right? And write about and get the resources for. And then show up again tomorrow to start again. Okay, you good? Let's register.